So what's your response to President Trump's travel ban, the main substance of his address last night?
I mean, I think I think the U.S.'s travel bans are, wholly incoherent. There are actually 5 different policies that apply to different parts of the world. For example, you're banned from a highly functioning health system like, say, Switzerland, but you can come in if you're from a low functioning health system like Russia or sub-Saharan Africa. But there's more than that. This doesn't make Americans safe at all. The epidemic here is just as bad, if not worse, than in most parts of Europe. And so by banning people who've been to Europe makes absolutely no sense. It doesn't make Americans one jot safer. Germs really just don't respect borders. This is not a trade war. This is not a political fight. This is a microbe, and you just can't erect travel bans and expect that you're going to be safe. Self-evidently, America is not safe.
To your logic, then, you would exclude the UK too, because there are more cases there than there are in some parts of Europe that are now banned.
Yes, I mean, of course, and there are places all around the world that have the same kind of case counts that you have in some parts of Europe. It's meaningless once you start to pick and choose among countries, start to count cases. Very, very little rationality behind it. I should say this also. The decision that President Trump made goes expressly against the World Health Organization express recommendations, and they violate the United States' treaty obligations under the international health regulations.
Both of which briefly say what?
Both of which briefly say no travel bans.
Because they're pointless.
Because they're pointless. They're absolutely pointless. And as WHO has just yesterday announced that they think that the world is on a pandemic status, we're all moving from what's known as containment to mitigation. And so containment means, well, we can just stop this, the way SARS doesn't exist anymore, or we stop MERS or other kinds of novel diseases. But H1N1, you couldn't stop. It was influenza. It actually still is here. It's actually in our seasonal vaccine. We don't even know it, but it's circulating all the time. This could be the same thing. We could now be in a stage where we just want to mitigate it. We want to slow it. So things like social distancing, school closures, trying to postpone or cancel mass gatherings, political events. The other thing that really does upset and sadden me is that President Trump doesn't become a good role model for this. He's continued to have political rallies. He's shaken hands with his supporters. And that doesn't just put the president at risk, it puts his supporters at risk. But much worse, his supporters will go out to their families, their communities, to people who are vulnerable and elderly, and pass the infection there. So what kind of a role model is that? We need a strong, science-based policy and a trusted person to tell America what we know, what we don't know, and what we're going to try to find out what we don't know, and to do it honestly and straightforwardly. That's just not happening.
But given President Trump is surrounded by experts, if he chooses to pull them in and listen to them, why then did he make a travel ban the centerpiece of this announcement?
Because I think he's sometimes listening to his public health task force and sometimes not. What he's doing now is he's conflating his travel and border policy with a public health fight against COVID. And so he thinks that what worked with immigration or trade, closing borders, is what you need to do against this microbe. And there's no scientific body that recommends it. CDC doesn't recommend it. WHO doesn't recommend it. This is coming straight from the White House, I can assure you. The travel bans just don't work. What does work are some of the things that we haven't done well, like rolling out tests. China, South Korea, Japan have done, magnitudes of orders of more testing than in the United States. We've defunded our public health agencies, our CDC, our state and local health officials. President Trump, one of the first things he did in office was fire the global health security chief in the National Security Council, even though he had just been warned that a pandemic was looming. And so it's just this, it's an utter lack of preparedness and regard. Job number one of any politician, whether it's Prime Minister Boris Johnson or President Trump or anyone, is to keep the public healthy and safe. There's nothing else. Everything else is secondary. And unfortunately, at least in America and actually many other countries, we're not doing a very good job of it.
And why the mess with the testing? In your view, what happened and what needs to happen? And why didn't he address it?
Well, I think we're fixing it, but it might be too little too late. So I do think in the next few weeks, we're going to see the rollout of millions of tests. But the truth is that we needed those tests weeks ago, because days and weeks matter crucially in an epidemic. And we're no longer probably in a phase where we can contain it, where testing really helps you identify cases, isolate them, contact trace, put them in quarantine. We may have passed that. And so, we had that sweet spot, and the window of opportunity may have closed.
But what happened? Why didn't we?
Why it didn't happen was a confluence of bad planning and a little bit of arrogance. So the United States thought, well, why should we buy test kits from Germany? Why should we use WHO-approved test kits? Let's just develop them our own. And so we developed them, and our manufacturers had a quality assurance problem with them. And there were too few tests, and we didn't have enough availability. The FDA hadn't approved many laboratories doing it. CDC's testing guidance was far too narrow. And the White House was just sitting back, probably at golfing or Mar-a-Lago. And so didn't coordinate or plan it. As a result, we were fatally deficient in our testing capacity.
Did people like yourself, one of the world's leading expert in pandemics and how governments respond to them, have you been brought in to advise the White House? You would expect them to bring in people like yourself?
You would absolutely would. I've been brought in by all of the major Democratic presidential candidates, people in Congress, NIH, CDC, the World Health Organization, but not the Trump administration.
Why?
Not the White House. Well, the White House has long been questioning of science. They actually, it's not well known, but apart from climate change, which is well known, and climate denial, the White House had advised the U.S. Centers for Disease Control and Prevention not to use the words evidence-based or science-based in its documents. And that's shocking. Why wouldn't government want to know what works and what doesn't, what there's good evidence for and what there isn't? So there's a shocking disregard for science and evidence. Now, I should say, it does pain me to make these criticisms, because this is a national and global crisis, and I do believe we all need to come together. This shouldn't be party political. This shouldn't be ideological. We should be all pulling together for the health of the American people and for the entire planet, because we are in a crisis. And in a crisis, we have to look out for one another. I urge people, go see your elderly neighbor, knock on the door. Don't ask what everybody owes you, but what do you owe to your community, to your family, to your neighbors, to keep everybody safe and secure. And we need to recapture somehow that tradition of the common good.
President Trump would say that's exactly what he was attempting to do. He did speak in those terms about people coming together and putting party politics to one side. Do you think he achieved that? Was he presidential in your view?
You know, the problem with President Trump is that he could say one thing one moment and say the other thing the next moment. So he has politicized it with China. I mean, the State Department and the White House have called it the Wuhan coronavirus. They've were one of the first to ban travel from China. They've made it as a political weapon. And by announcing, travel restrictions or travel bans, and then saying we need to come together, we're not coming together as a global community, quite the reverse, we're unraveling.
He means come together as Americans.
He does mean come together as Americans.
As you say, the way he does with global trade disputes.
Yeah,
it's an inward-looking message.
It's a very inward-looking message. Now, I believe in both. I think we need to come together as Americans, and I think we have to come together as a global society. One of the things that the White House did that really perplexed me and other Americans is they said that the scientists should clear their health messaging on COVID-19 with the White House, which is exactly backwards. It's the White House that should clear its health messaging with public health professionals. And that just gives you a tenor, a tone of what's going on in the United States.
And that never would have happened in the past?
Not under President Obama, not under President Bush, not at all. Remember, President Bush started PEPFAR, the greatest U.S. health aid program in the history of the world, helping sub-Saharan Africa in an AIDS epidemic. Remember, President Obama was the leader in the West African Ebola crisis, sending the military in, getting a huge emergency appropriation, getting a United States Security Council resolution, and days after he made the announcement for sending the military to Liberia, the UK and France sent their militaries into West Africa as well. So that was leadership. And we're certainly not seeing that now.
Travel ban aside then, what would you like to have seen him do? What needs to be done now? What should have been the message to the American people here who are desperate for that leadership?
They are. I mean, there's some very, very clear answers. We don't need the draconian methods that we've seen in China, locking down Wuhan and wider Hubei province of 60 million people. People
would say, is that not what has caused the decrease in the virus there?
That's what WHO said, but this is important. The same decrease occurred in South Korea and Japan without draconian methods. We can do this with a tried and true public health approach. We've done it with all other diseases in the past.
Which is?
Which is widespread testing, contact tracing, isolation and quarantine for those who are a significant risk to the public, social distancing, school closures, trying to cancel all mass gatherings, church services, looking out for business conventions, political rallies and political conventions, remote working and remote learning. In other words, now what we need to do is to flatten the curve and buy ourselves time before we can get a specific treatment, which could be online within a few months, or a vaccine, which unfortunately won't be here for another year to a year and a half.
And to be clear, all those measures that you just outlined should be, in your view, put in place in the US and globally right now.
Right now, absolutely. I mean, there may be some pockets around the world where it's so early that you can just use containment and you don't have to, close everything, mass events down. But I think in most places you do, and certainly in the United States. I mean, the signs have been here for so clear and for so long that there's a lot of silent transmission in the community going on all over the United States.
So why then, just lastly, why didn't President Trump say that? It's a very simple list. It took you 20 seconds to say it. It was very powerful. It would have sent the message, don't panic, but this is what we need to do to flatten that curve. We're all in this together. Why didn't he do that?
I think because he mistakes border control with public health. And somehow he thinks that, America first means battening down the hatches and, don't let those people come here, and that will work. But that's not what the public health people are telling him. I can assure you, I know just about everybody on the White House task force, and I've known them for years. And I can assure you that that's not the message they're telling him. Nobody's saying that border closures are the answer to this. I believe he did that for political reasons, because it makes him look tough. If you ban travel, it's America first, you're looking tough, you're looking after Americans. That's the message he's trying to send. I think there will be, a small a percentage of America that will be very happy with that. But I can assure you, in the halls of the CDC, state and local health departments, people are shaking their heads.
Professor, thank you very much.
My pleasure. Thank you for having me.